Hello everybody and welcome back to another exciting and informational episode on My Beat Goes On. As always, my name is Chris and I'll be your host today. And today we're taking a dive into the newer drug Entresto, and something that some people call the miracle drug. So we're going to get some information on this, just lay it out clean and simple for you, and we're going to find out, is this potentially the miracle drug that people say it is? And before we get started, I'm going to say that any of these words that I mess up, like drug names and stuff like that, I apologize, but I'm going to do them phonically, and that's about the best anybody's going to get out of me, because some of these are probably really weird sounding, so phonically is the way we're going. So I apologize if I'm wrong. You can correct me in the comments. First off, what is Entresto? Entresto is a combination of two drugs, sacubitril and valsartan. Sacubitril is a neprilysin inhibitor, which is actually a new type of drug that came out, which we won't get into this episode, but it's a new class of drug. And it has valsartan, which is an angiotensin receptor blocker. Sometimes people call those ARBs. If you're used to hearing ARB, that's what it is. So like I said, sacubitril is a new drug. Therefore, it's not available as a generic yet, which is why Entresto can only be bought as name brand right now. And it was created by Novartis Pharmaceuticals, and most of the information I got for this came off of their website, and some of it off of their information pamphlet that they put in with the medication. So what is the indications for use of Entresto? It's indicated for heart failure patients with chronic heart failure, which is NYHA class 2 to 4 and reduced ejection fraction. If you don't know what NYHA class 2 to 4 is, it's basically classes of your limitations on physical activity, how you feel at rest and during physical activity. So you can look that up, see what it is. But it essentially goes with class B through D heart failure. It also is used to reduce the risk of cardiovascular death and hospitalization. It's used in conjunction with other heart failure therapies, and it's used in place of ACE inhibitors or other ARBs. Some of the contraindications, these are people that would not want to use it. The first one is pregnancy or breastfeeding, and this is the only time it will be used is unless it's medically indicated and considered a life-saving medication for the mother. But this has a pretty high risk of birth defects and especially miscarriages. And as far as for breastfeeding, they don't know yet if it carries over into breast milk. So it's said not to use it while breastfeeding. Or if you do have a kid, don't breastfeed while you're on it, just bottle feed them. Also, you don't want to use it if you have hypersensitivity or an allergy to any component of Entresto. If you have a history of angioedema related to ACE inhibitor, ARB therapy, if it's inherited, or for any other unknown reason. If you don't know, angioedema is swelling, particularly in your face, throat, neck, something that can inhibit breathing, constrict your airway. So if you have that, you're not supposed to take this. Concomitant use of ACE inhibitors, which means you don't use it with an ACE inhibitor. If you're taking an ACE inhibitor, you need a 36-hour washout from switching to Entresto or from stopping Entresto and going to an ACE inhibitor. So that just basically means you need to go 36 hours in between taking the two drugs. You don't want to take it with use of aliskiren in patients with diabetes. I couldn't figure out why just with diabetes, but that's what it says. I would probably, if you're taking aliskiren, I'd probably say it's better not to take them both at the same time. I have not figured out, I couldn't figure out through research what diabetes had to do with it. You don't want to take it if you have a potassium level where the lab level is greater than 5.4 millimoles per liter, which is essentially when you get your potassium lab work, it comes in that number. So if it says 5.4 or higher than 5.4, you don't want to take this. And since this has a really big effect for most people on lowering blood pressure, if your systolic blood pressure is below 100, you don't want to take this medication. So we have some side effects that go along with this, and these come from the clinical trial, which I'm planning the next episode to actually be completely about the clinical trial, so you can all see how this was determined to be a very effective medicine. But side effects that were greater than 5% versus Enalapril, which was the drug used in the clinical trials against Entresto. So as you can see with Entresto, there was 4,203 people, and Enalapril, 4,229 people. So with this, hypotension happened in 18% of people with Entresto. Hyperkalemia, which is the high potassium, happened in 12%. Cough was 9%, dizziness 6%, and renal failure, acute renal failure, was 5%. And as you can see, some of these match up with Enalapril. Obviously, the hypotension, because of the blood pressure effect that Entresto has, it was higher. But a lot of the other stuff is roughly the same. So, as you can see, side effect wise, it's not terrible drug compared to the rest of them. Hypotension, if that's the worst side effect, that's not too bad. I know some people get nervous when they see renal failure, acute renal failure at 5%, which works out to about 1 in 20 people. But you have to think with that, people are also taking all their other medications, which could be diuretics, other blood pressure medicine. So these side effects can't necessarily be pinpointed strictly to Entresto. So think about that when you're seeing these numbers. Just because they're there doesn't mean it was Entresto's fault completely, or that was the cause of it. It could have been any of the other treatments that they were actually on. Some other notable clinical trial side effects for Entresto was angioedema, happened in about 0.5%, and in African Americans it actually was a lot higher at 2.4%. So that's just something to consider if you're an African American. Orthostasis was 2.1%, which is essentially just a reduce in blood pressure from sitting to standing or the other way around. You have falls, which were about 1.9%, which is going to come with that, getting dizzy when you stand up and the hypotensive effect that this medication has. Some of the lab values, there was a decrease in hemoglobin and hematocrit of about 5%, increase in serum creatinine of greater than 50% in about 16% of people, and potassium concentrations greater than 5.5 milliequivalents per liter was approximately 16%. Some of the warnings that come along with this medication that you'll see when you get your little pamphlet is fetal toxicity, angioedema, which we said is higher in African Americans, hypotension, which is always something that's going to come along with a blood pressure medicine, hyperkalemia, and impaired renal function. And again, some of those, when you're taking them with other medications, they can't necessarily pinpoint it on Entresto itself, but it's something to be aware of. With this, some precautions continued. Do not drive or operate heavy machinery until you know how it affects you. Obviously, you don't want to take this medication for the first time right before you go on a road trip or anything like that. And avoid alcohol while using Entresto, which pretty much is a warning that comes with most any medication these days. Some personal tips that I would have for this would be to take your first dose in the evening when you have nothing else to do, and take it a little bit before bedtime, just so you can see how it does affect you. Try to start the medication during the week in case you need to contact your doctor for anything, or if you have any issues or questions. If you take it on a Friday night, you don't want to have to wait until Monday morning to give them a call. So I would say probably try it during the middle of the week. You also want to check your blood pressure before the first dose. Definitely make sure you're not below 100 on the systolic. And then about 2 to 3 hours after taking the medicine. And do that for about the first week to see how it affects you. And here in a little bit, I'm not sure if it's the next slide or a few more down, you'll see why I say to do that. So the dosage for this drug and how to administer it. There is a 36-hour washout period of taking an ACE inhibitor, which we went over that. The recommended starting dose is 49/51 milligrams, and the valsartan is always the second one in this, so that's how it's ordered. You double each dose after 2 to 4 weeks to the maintenance dose of 97/103 milligrams twice daily, as tolerated, of course. Pills must be taken in whole form and can be taken with or without food. You do not want to crush, break, or chew these tablets. They need to be taken as they're dispensed to you. And Entresto is unlikely to be removed from hemodialysis because of its high protein binding. For any of you who are on dialysis, this is something good to know about your medication. Patients not taking ACE inhibitors or ARBs, or previously taking low dose of medication, or patients with severe renal impairment where your GFR is less than 30, there's no adjustment for mild or moderate renal impairment. And patients with moderate hepatic impairment, the Child-Pugh B classification, these are all people that are going to need a dose adjustment. There's no adjustment for mild hepatic impairment, and it's not recommended if you happen to have severe hepatic impairment. But for all of those above on this slide itself, we're going to start at the lowest dose, which is 24/26, twice daily, doubling the dose every 2 weeks to the target maintenance dose of 97/103 milligrams twice daily, as you can tolerate it. So if you have any of these conditions or not taking those medications as stated, this is really where you want to start. And this is good to know just in case your doctor wants to accidentally start you on a higher dose without thinking about this. So keep this in mind. You're probably going to want to start on the lower dose. And honestly, with this medication, I'd probably personally, even if these didn't fit me, I'd want to start on the lower dose just because of how much this affects blood pressure. But that's just me personally. As always, do what your doctor recommends and voice your concerns to him. So as far as peak concentrations, and this is where we get into the whole checking yourself 2 to 3 hours after your first dose, and then for the next week or so, checking your blood pressure to see what it does. The sacubitril, once you take it, is consumed or metabolized into the chemical LBQ657. So when we're talking about this, that's just so you know, that's just the sacubitril once it's metabolized. So the peak, the sacubitril is in your blood. It peaks at a half an hour. The LBQ657 peaks at 2 hours, and the valsartan peaks at 1.5 hours, which is why I said take your blood pressure about 2 to 3 hours after you take your first dose. The half-life, or how long this essentially affects you, the sacubitril is about 1.4 hours, the LBQ657 is 11.5 hours, and valsartan is about 9.9 hours. So taking twice daily dose, the steady state levels of sacubitril, LBQ657, and valsartan is reached in 3 days, and LBQ657 accumulates by 1.6-fold at steady state, and the other two do not accumulate significantly at steady state, which this is why I said take your blood pressure for about the first week at least consistently. That way, as you reach steady state levels, you'll know exactly what's going on with your blood pressure. As far as for overdosage, which happens to the best of us, we got a lot going on, a lot of things that give us cloudy brains. So the overdose was actually tested in healthy volunteers. They were given a single dose of Entresto of 583,617, which was 6 times above the maintenance dose. And they were given multiple doses of 437,463, which is 4 times or 4.5 times above the maintenance dose for 14 days. And when they did this, these were well tolerated. The main side effect in this was obviously hypotension. So it looks like if you accidentally take a second dose, for the general population, it shouldn't do anything other than just give you lower blood pressure. But as always, you want to contact your doctor or go to the ER if you feel like something's going on that shouldn't be. As far as for drug interactions, which if you look at the list I have a list. There's about 4 pages of them. Some of them are just little things. Some are bigger things. There's a whole bunch of them. So make sure you at least look these up when you're taking this so you know. But obviously the first one's ACE inhibitor, which I know I'm repeating myself, but it's extremely important not to take these 2 at the same time. You also want to watch out for potassium-sparing diuretics. I got a list of a couple of them here, and obviously there's more. Potassium supplements and salt substitutes containing potassium, just because this drug seems to increase your serum potassium levels. So be careful with that. You also don't want to take non-steroidal anti-inflammatory drugs or NSAIDs, including selective COX-2 inhibitors, which I'm not even going to try to say that word right now because it's really long with a lot of weird letters. But COX-2 inhibitors and NSAIDs, don't want to take them. They can cause worsening of renal failure, including possible acute renal failure. The only good thing to this is that in their tests, it was usually reversible. But we don't want to risk usually reversible, so I say just don't take them. And lithium, if you're having to take that, which is usually used for mental health issues, it can possibly increase lithium concentrations, and lithium toxicity has been reported. So make sure if you're taking any of these, you just let your doctor know. Sometimes when our cardiologists don't know everything we're taking, I mean, the only way they really know is if we tell them. So just know what you're taking and make sure you give them the full list, including herbal supplements and stuff like that. Good thing for them to know anyway, but especially with this medication. Now, the one thing a lot of people wonder is there a generic in the near future? Well, let's see. Entresto falls under a new chemical entity, NCE exclusivity. The exclusivity started on July 7th, 2015 when Entresto was approved. The NCE exclusivity lasts for a period of 5 years, which means, in theory, on July 7th, 2020, applications for generic form of Entresto can be submitted by other drug makers. With it being said, approval for those drug makers can take sometimes 6 months or less, and that's if it's a medication that's considered significant advance in medical care. They can be approved pretty quick, but it can take significantly longer or never approved, especially if applications are incomplete or the drug, the formula that they're submitting on their application doesn't meet FDA standards. So, while it's possible as early as 2020 they can put these in, it's probably going to take multiple months before we even see them start being produced. Now, there are certain patents that can block generic approvals. Of all the patents I could find for Entresto, which I'm sure there's a ton of them, but these are the ones that I found online. The last ones end in 2027, but most of them end in 2023. And I couldn't find any ones that specifically mentioned exclusivity periods or blocking of generics. They just seem to be more about the drug itself. I reached out to Novartis. I emailed their customer service and asked them specifically when the drug was going to be made generic or whenever it was going to run out their exclusivity, which I received a response, and it absolutely did not answer my question. So all I can do on this is make an educated guess, and that is that exclusivity will end July 7th, 2020. Hopefully, we will find generics possibly as early as 2021. That's what I'm hoping, but as I said, it's only an educated guess. People always wonder too, while you're waiting for the generic, is there financial assistance? Which there absolutely is. If you Google Entresto patient assistance, you're going to find a ton of stuff. I found stuff for first 30 days free. There's other financial assistance. There's way too many to list here, but I'm just letting you know, you type that exact phrase in your Google search bar, you're going to find something. So, As we go back to the very beginning, is this the miracle drug people say it is? First off, I asked, do you think Entresto is a miracle drug? Well, there's a lot of people that do. There's some people that don't. Just like any drug, some of them work fantastic for some people, some don't work that good at all. But I have seen people in our heart failure group talking about some really good improvements in their EF and how much better this drug does make them feel. Do I think it's a miracle drug? Personally, I think miracle is a strong word. I do think it's a great advancement in heart failure treatment. I think it's going to help a lot of people to live longer, live better lives. But as far as miracle, I would say probably not a miracle. But I am going to say that it is a really big advancement because I've read the trials, I've seen what people say online, and I really do think this is going to help a lot of people. The next episode, we're going to show all the significant numbers and stats from the clinical trials and the tests that show how significant this drug will be to the heart failure community. And I do want to say, if anybody from Novartis is watching, first off, I hope I'm saying your company right. If not, you can fuss at me in the comments. But I do want to thank you and everybody that works there who did create this drug to help all of us heart failure warriors out there. We really do appreciate people taking the time and the effort to make these drugs for us, to help us live longer, better lives, and to be around our families as long as possible. So my final thoughts is that while this drug is expensive, I do think it is important for Novartis to recover financially for their expenses in creating this drug, which I know we don't like because it's expensive and it kind of stinks. But when they recover their money, and even if they make a profit, this is still an incentive for them to create even better drugs in the future. So I want them to recover financially so that they can create more and better drugs for us. And I hope you feel the same way. If not, that's okay, but, I'm not going to be creating drugs anytime soon, and I know a lot of people out there aren't going to be. So we need these people making these drugs for us. Some of the side effects, they do seem scary, but like I said, there's routine testing that can help keep the side effects to a minimum, and most side effects that we saw do happen without Entresto. So it's important just to keep your doctor and lab appointments, and that's no matter what your treatment is, just so you can see what's going on in your body. And while it may not be, a quote-unquote miracle, it is an amazing step towards heart failure treatment and worth asking your doctor about. So to wrap it up, we got some questions to ask your doctor. The first one, obviously, is, do you think I should try Entresto? You should ask, is the 36-hour washout period safe for me? Are you going to be safe going a day and a half or more without your blood pressure medicine? What should my blood pressure be at or above when taking this medication? We said below 100, but if you're somebody who's at 120 and you drop to 80, you may need to consider, if your blood pressure is too low, you might not want to take this drug, or you might want to ask your doctor about if you should skip a dose until your blood pressure comes back up. Then you want to ask, do the parameters change after 3 days when the drug levels are stabilized in my body? So first, this may have a bigger effect on your blood pressure, and as you stabilize out, your body may get used to it. Or is it going to be something where it's not so bad at first, but when you stabilize, your blood pressure gets a little bit lower and lower? So these are things, another reason why you want to take your blood pressure. It's best to keep a log, and then you can work out with your doctor what your parameters are. You want to know, what should I do if I miss a dose? Or what you should do if you accidentally take a second dose or think you took an extra dose. You want to know what symptoms require a call to you, the doctor, or a trip to the emergency department. You want to know, how often will I need my blood work to check your potassium and renal function. That way that if they forget to schedule you, you know that you should have one coming up. You can call them and make it yourself. What are the symptoms of high potassium or acute kidney failure? This is something a lot of people hear about, but they don't know what actually happens in their body when these things start to happen. So it's good to get some information on this from your doctor. You might want to know what your daily potassium intake should be. A lot of us know our sodium, but when you start taking drugs that affect your potassium, it's really good to get a number, because the recommended amount, I think, is about 4,700 milligrams, which is a lot, and a lot of people don't even get that much. But if it's going to affect your potassium level, you may need a whole lot less than that. So it's good to know with any drug that affects your potassium what the potassium intake should be. You want to know if you're taking a daily aspirin regimen, should I discontinue it? Maybe switch it to something like Plavix or another blood thinner, or if they think you should keep it and just watch your renal function. So make sure you discuss that with them. What should you take for pain relief other than NSAIDs? A good one that I take is Tylenol, but of course you always want to check with your doctor. Just ask them what you should use for pain relief. If you are a woman and you are in childbearing years at risk for getting pregnant, ask them what a safe birth control to take with Entresto is. I'll be the first to say I'm not familiar with a lot of birth control methods, but I know that there's the pills and stuff they implant in you, and I don't know what effect they have on you. So make sure you discuss that with them. And then you can always ask them if they have any free trials or assistance that they know about for Entresto. A lot of times the doctors that prescribe this, even if they're getting some form of kickback from prescribing Entresto, they usually have ways for you to financially lessen the impact on you. Maybe free trials or a social worker you can talk with that can help you out with different programs. So those are all good things to ask your doctor. Of course, there's plenty more you can think of on your own, but these are some of the big ones I can think of. And that's going to wrap this episode up. I apologize, it was a little bit longer than usual, but I didn't want to break this up. I thought it was important to get everything out there in one episode. So I hope you enjoyed this. If you found some value in this, please feel free to leave a comment, a like, subscribe, turn on notifications so you get all the videos from here on out. And of course, we got the links to our heart failure support group and our website in the description for the video. So make sure you check that out. And of course, until next time, keep on smiling, and we will see you next episode.